Based on 2020 data, and the numbers have only gotten worse since then, 17% of adolescents have had one or more major depressive episodes. It's just between the ages of 12 and 17. I think a lot of people are worried that the number is going to be close to 1 in 5 with where things are going, and it's certainly trending in that in that direction. And even 12%, so 1 in 8 adolescents, severe impairment from their depression, struggles getting up in the morning to get to school, being in hospitals related to suicidality, severe self-harm, dropping out of sports, dropping down in grades, those kind of things. And even amongst those individuals who have those severe impairments, only half of them are getting treatment, which is, of course, a real crime in our country with the resources that we have. Keep in mind here that in adolescents, females are actually significantly more likely than males to have depressive episodes. This gap has actually widened since I was an adolescent myself. And the demographics vary dramatically about who's having these depressive episodes. So the single highest risk group are individuals who have more than one race, and whites, incidentally enough, are the second highest group when you take a look at adolescent depression. Part of the sub-breakdown on this data is that it turns out in the past we often associated much of mental illness in adolescence to individuals on the lower socioeconomic status, and for good reason. Those kids face a lot of challenges and absolutely do have a lot of struggles, but it has turned out that in recent years, actually the kids at the highest social economic status at the best schools and the most competitive schools have significantly higher rates of depression and anxiety than their same race peers that are at kind of more middle of the road average schools. And so we've very clearly seen an effect on adolescent mental health that would start to bridge into a philosophy and law and other debate about what is going on in that group. And that is a big part of the reason why, obviously with the racial inequity in this country, that whites have the second highest rate of major depression.